Today, Dr. We are Group 3. Our topic is an optimization of QR inventory policy based on healthcare apparel products with compound Poisson demands. My name is Gao Lanlan. In introduction, a health care center is the topic of this case study. It is a non-profit organization that helps handicapped and elderly people with custom-made clothing. Example: wheelchair raincoat, safety jumpsuit, apron. The facility cannot have too much cloth material in stock due to its limited inventory capacity. Meanwhile, due to limited funding, it is necessary to reduce the operation cost, including inventory cost. Customer orders are unpredictable and arrive at irregular intervals. In Poisson process model for a series of events will arrange time between events is known. The exact timing of events is random. This is example picture. In QR policy, most widely used for stochastic inventory system and no straightforward solution for computing QR policy. In this case study, there are 4 problem statements. It's a limitation of storage space, limitation in production capacity, limitation of resources, and stochastic customer demands. In general problem statement, determine optimal Q in the objective of minimization of a range cost, including purchase cost and delivery cost. Find a solution easy to carry out for practical inventory control and meaningful to academic research.
Good day, Dr. Majid. My name is Yong Lo. So in methodology, in order to test the validity of the model, we will compare a group of real data and the difference between the optimal result of genetic algorithm and the policy determined by human being in real practice. So in this case study, we will use some method to solve the problem as stated previously. First, we will state the overview and the preliminary of this case study, which is we will define our parameters, our decision variables, assumption, and also some preliminaries. Then we will use the QR policy, which is a policy of inventory review on a constant schedule. So we will order a quantity Q whenever our inventory level is reached on a reorder level R. This policy is also named as a two-bin policy. Next, we will have an optimal policy on SS level. The big S is denoted as the maximum and the small s is denoted as the minimum. So this is also called as a maximum and minimum inventory policy. So mainly we will perform a replacement order when the on-hand inventory fall below a minimum and restore them to a target on the maximum. Quantity is found by using the maximum level minus the minimum level. Well, when we set our minimum level as the reorder point, then our maximum level will be found by using the reorder point plus with our quantity. So the optimal policy of R determined by service level is also used as our methodology. So we will have 2 measurements, which is the first one is SLM1 and second one is SLM2. So for SLM1, it is expected that the fraction of all demand that is met on time, while SLM2 is expected number of cycles per year during which a shortage occurs. Next, we will move to the case study of this article. The model is built in the context of a 3-echelon supply chain as shown as below. So the supplier will supply their stock to the healthcare center, then the healthcare center will supply their stock to the customer, which is they will provide some tailor-made clothes to the disabled and also the old. So customer will sometimes demand from the healthcare center, then the customer demand are depicted as compound of Poisson process. So this is a single item inventory system, and we will have some assumption and condition for this system, which is the lead time is constant and secondly, our purchase cost is fixed, and finally, our back order is enabled. Meanwhile, in this case study, the researcher found some complexity increase whenever the model is having an unfixed customer orders, the random order arrival, the stochastic order cycle, and also non-linear stock level. Since there are so many complexities in this model, the objective of this model is to achieve a minimum average cost on the order cycle. After we have determined our complexity and also the problem in this case study, and also we have fixed our objective to this case study, next we will introduce the parameter and also the decision variable. So the parameter are the AC, which is our average cost on an order cycle, L is the lead time of material procurement, H is the holding cost, P is the stock out cost, A is the ordering cost, while alpha is the service level. So our decision variable will be Q, which is our order quantity in unit per order.
Thank you, Yunde, and good day, doctor. I am Chen Yi, and I will now explain the effect of QR policy on the healthcare apparel product management. So we will assume the customer demand per unit time is 1, and the maximum point of the order point and the order quantity is 120. So we will mainly compare the generated algorithm, which is the QR policy based on the continuous customer demand, and the business practitioner policy, which is the original policy that the business owner use without the QR policy. And within these two policies, we will focus on the expected average cost for each item. So based on the result in the previous slide, we can see that the average cost for each item is expected to reduce at around 17 to 20% with the generated algorithm. So this means when we use the QR policy, we can successfully minimize the average cost for each item. Next, we would like to do some sensitivity analysis on this QR policy. First, when we increase the order quantity, then the larger order quantity will lead to increasing in the ordering cost on each unit, and hence we will have increasing effect on the average cost. Secondly, increasing in the customer demand per unit time will increase the reorder point and the order quantity. So it is due to avoid stock up from occurring, and hence the average cost will be increased. Thirdly, increasing in the stock up cost per unit time will increase the reorder point and the average cost. It is due to when the stockage cost increase, we need to avoid from charge from this stockage penalty. So we need to increase the level of reorder point to avoid the stock out situation. And finally, when the order quantity is increased, then the larger order quantity will increase the inventory cost of each unit, and finally will increase the average cost. We have come to the conclusion for our presentation. So, an inventory system registration on capacity for the case of the healthcare center based on the QR policy is proposed. This policy is expected to reduce the average cost by 17 to 20% than before. However, there is some future work need to be done on this research. This before this research is only contain single item inventory system. But however, in real life, the resource can be commonly shared across different items. And so the optimization problem for multi-item QR policy with a concept of such a resource will become more complex. And this will be the direction for our future research. That's all for our presentation from Group 3. Thank you.